Hi guys, my name is Mary Nicladius. I'm going to talk about PET-CT. What is a PET-CT scan? A PET-CT scan is a medical test that helps doctors find and understand diseases inside the body, especially cancer. It combines two types of scans into one. The PET scan shows how parts of the body are working, while the CT scan shows what the inside of the body looks like. How does it work? Before the scan, a small amount of radioactive material called a tracer is injected into a vein. This tracer travels through the body and collects in areas with high activity, such as cancer cells, because they use more energy. A special camera then takes picture showing where the tracer has gone. This helps doctors see if there are any problems even before they show up on other types of scans. Why is it useful? The CT part of the scan uses X-rays to take detailed pictures of the body's organs and tissues. When the PET and CT images are combined, doctors can get a more complete view. This helps them find diseases early, decide on the best treatment, and check if a treatment is working. The scan is mostly painless, and the amount of radiation used is very small and carefully controlled. The advantages of using PET-CT. PET-CT scans are very helpful because they let doctors see both how the body looks and how it is working. This gives doctors important information to find and treat many health problems. One big advantage of PET-CT is that it can find diseases, especially cancer, very early. Cancer cells usually grow fast and use more energy, so they show up clearly on PET scans before other scans like CT or MRI can see them. Finding diseases early means doctors can start treatment sooner, which help patients get better results. PET-CT also helps doctors make more accurate diagnoses because it shows both the shape of organs and how active the cells are. This helps tell if a growth is harmless or dangerous, and shows exactly where a problem is. For example, in cancer, PET-CT helps figure out how far the disease has spread, which is important for planning treatment. Another benefit is that PET-CT supports personalized treatment. By seeing the size, place, and activity of a tumor, doctors can choose the best treatment for each patient, like surgery, radiation, or chemotherapy. It also helps doctors check if the treatment is working by showing changes in the tumor's activity over time. PET-CT is safe and easy for patients because it does not involve surgery or painful procedures. The scan is quick and usually comfortable, with only a small amount of radiation that is considered safe. Besides cancer, PET-CT is also useful for many other health issues. It helps doctors look at heart problems by showing how well blood flows to the heart and can detect blockages. It also helps with brain conditions like Alzheimer's or epilepsy by showing how the brain is working. Plus, it can find infections or inflammation in the body. What are some common uses? It detects cancer and make a diagnosis. PET scans can help find cancer by showing areas in the body where cells are unusually active, which often means cancer is present. This helps doctor confirm if a suspicious lump or symptom is actually cancer. Check if cancer has spread in the body. Once cancer is diagnosed, PET-CT scans can show whether it has spread to other parts of the body. This helps doctor understand the full extent of the disease. See how well cancer treatment is working. During or after treatment, PET-CT scan can show if the cancer cells are still active or if they have been destroyed, helping doctors decide if the current treatment should continue or change. Find out if cancer has returned after treatment. PET-CT can detect if cancer comes back by spotting active cancer cells before they cause symptoms or show up on other scans. Evaluate a patient's outlook. By showing how aggressive or widespread a disease is, PET-CT helps doctors estimate how a patient might respond to treatment and what to expect going forward. Assess how tissues and organs are working. PET scans reveal how well organs or tissue are functioning by measuring their metabolic activity, which can help identify damaged or unhealthy areas. Determine the effects of a heart attack on the heart. After a heart attack, PET scans can show which parts of the heart muscle are damaged and not working well, helping guide treatment decisions. Identifying parts of the heart that might benefit from surgery, a procedure like angioplasty. PET scans can locate areas of the heart with poor blood flow that may improve after treatments like bypass surgery or angioplasty. Evaluate brain problems such as tumors, memory disorders, seizures, and other brain conditions. PET scans help find abnormal areas in the brain, assess diseases like Alzheimer's or epilepsy, and guide treatment plans. Study normal brain and heart function. Researchers and doctors use PET scan to map how healthy brains and hearts work, helping improve understanding and treatment of diseases. Limitations: radiation exposure. PET-CT uses radiation, which might slightly increase the risk of health problems like cancer. Efforts are being made to lower the risk by using smaller amounts of radioactive materials and improving the technology. Image quality issues. The images can sometimes have problems called artifacts caused by things like patient movement or body differences. These can make it harder to read the scan correctly or measure things accurately. High cost and limited availability. PET-CT scans are expensive and may not be available in all hospitals or countries. Work is going to make the machines and materials more affordable and easier to access. Future directions and opportunities of PET-CT imaging. Personalized medicine and theranostics. PET-CT helps doctors create treatment plans that are tailored to each patient. Theranostics, where the same radioactive drug is used both to find and treat diseases, is becoming an exciting new approach in nuclear medicine. Combining PET-CT with other imaging methods. PET-CT may be combined with other scans like MRI or ultrasound to give more detailed and complete information. This helps doctors make more accurate diagnoses. More uses in the medicine and research. PET is already used in cancer, heart, and brain care. In the future, new types of tracers and better scanning techniques will allow it to be used in even more areas of medicine and research. Thank you so much for listening.